Hey, Dr. DiMattina at Dominion Fertility, Medical Director and Founder of Dominion Fertility. So patients are asking all the time about embryo grading. What's the grade of my embryo? And I have to tell you that I rarely look at that myself. And that's because things have changed. At Dominion Fertility, we do PGT, pre-implantation genetic testing, so we can test the embryo and make sure it's healthy, that is, genetically normal, before we put the embryo back into the patient. And that gives us our tremendous pregnancy rates that we get here at Dominion Fertility. So here's a story on embryo grading that everybody's asking about. So if an embryo makes it to a blastocyst, which is what we want, a blastocyst is then graded to whether or not it's suitable for a biopsy. And if it is suitable for the PGT embryo biopsy, that's a great embryo. And we don't rank them. There's not like there's a first class or second class embryo. So then all we need is the genetic result. If it's PGT normal, or euploid they call that, that's what we want. And it's not like one euploid embryo or genetically normal embryo is better than the others. They're all equivalent, and they all have the same genetic chance of producing a baby, which is what we want. And so my pregnancy rates usually run around 70-75%. I cannot get that pregnancy rate unless we do PGT and know that the embryo is genetically normal before we put it back in the uterus. So embryo grading, ladies, don't worry, okay? Once they're biopsied, they're all the same. So embryo grading is not as important as it used to be prior to the days of PGT. I hope that helps. Dr. D at Dominion Fertility, show me the baby.
Dominion Fertility, making miracles happen, one family at a time.